Hi Didrik, hi everybody. I'm sending my regards from Slovenia, where we are currently also fighting against this coronavirus. Today is 1st of April, and till yesterday we had 802 patients who were diagnosed with COVID, and we have 28 of them who are in intensive care because of it. We have 16 entering points through the whole country where you can get tested for the new virus. And we completely changed the way how our healthcare is working. So we stop with everything what is not urgent. So we don't do prevention anymore, we don't do physiotherapy anymore, we don't perform operations which are not urgent, but we still do like urgent operations and operations in patients who have cancer. There's a lot of staff from these areas, and we use them to help us in these entering points or somewhere else where they are now more than needed. The gynecology is still working for the pregnant woman. We are still taking care of them, but we completely change also the approach to primary care centers. So everything, all the triage and everything is done, all the contact with your general practitioner is done through the phone or email or other viral media. You can't enter community center if you didn't make an appointment. So you have to get in contact through the phone. Also, we are prescribing therapy through the phone, but only for a month. Usually we do this for 3 months. When you make an appointment, there's a nurse waiting for you on the entry. She has a list of everybody who have a meeting this day, and if you are not on that list, you can't enter. You only are able to enter if you did an appointment. She gives you hand sanitizer, she does a triage, and so on and so forth. So if there's a suspicion that you have an infection with this coronavirus, you have to make a contact through the phone, email, or whatever, not in person, with your general practitioner, and he or she gives you all the necessary information, how to proceed, what to do, and so on. There's a big role of community nurses right now. They are still working, they are still providing care for mothers and babies and for all the chronically ill patients. But they are just dividing the days when they are visiting like mothers, and these are the different days when they are visiting chronically ill patients. From our midwives and nurses association, we have a website, and they did all the informations about COVID, Corona, all the guidelines for different working areas. There is a lot of guidelines, so if you have any questions or you need something to use in your working area, you can go on our website and you can just check it, and you have all the informations which are needed in these urgent situations, that you know how to proceed and what to do. We are also working a lot now with our Midwives and Nurses Association with elderly homes, because there we have a lot of problems there also, because there are infections going on also, and they are our most vulnerable patients, and our elderly homes were not built in a way to do isolation, like cohort isolation. So we are trying to help them and to support them how to do and provide this type of care. We have, like I think everybody now, a big shortage of protective gear. Our government is working hard to get them, that it's also safe for our healthcare workers to work. For all the rest of us, we have a complete lockdown. We have to stay at home, children's are homeschooled now. You can only leave your house if you have to go to see a doctor, to go to pharmacy, or to go to a store. And we are allowed only to move around our own municipality where you live. You can't go to another place. So the life as we know it has changed completely, and we are doing all the best. And we are coming in the phase in Slovenia where we will see how good our approach was. And I hope for the best, that we are not going to have the worst case scenario. We are all working a lot. Most of the time, the doctor and the nurse in primary care, they're working in shifts. So they're working 1 week in a row, and then they have a week off, and so on and so forth. And in hospitals, they are working for 12 hours because we don't have a lot of staff. And a lot of staff is also in self-isolation because they got in contact with patients who were COVID positive and they didn't know. So we will see how the things are going from this point, and we are hoping for the best. We are all working in that way, and we are trying to support our friends and families. And I'm sending my love and my condolences to Italy, Spain, and all the other countries. And I know that we will get through this as soon as possible. I hope so. And I really do. I wish you all the best, and please stay healthy.